Let's discuss the precancerous derm lesions. Let's start off with actinic keratosis. Actinic keratosis is one of the most common precancerous skin lesions resulting from chronic and cumulative exposure to ultraviolet radiation, particularly in fair-skinned individuals. These lesions represent keratinocyte proliferation, atypical, and are considered premalignant because they carry a small risk of progression if left untreated. AKs are most commonly seen in older adults, particularly those with a history of significant sun exposure, tanning bed use, or outdoor occupations. AK presents as a pink or flesh-colored, scaly rough dry patch or papule on sun-exposed areas, such as the face, ears, scalp, neck, dorsal hands, and forearms. Patients may describe the lesion as asymptomatic or report mild tenderness, burning, or itching. The hallmark of AK is its rough texture, often felt more easily than seen, commonly described as sandpaper-like quality on palpation. Lesions are typically small, a few millimeters, to 1 to 2 centimeters, but can coalesce into larger plaques. The diagnosis is usually made clinically based on history and characteristic appearance. However, a skin biopsy may be performed when the lesion is hypertrophic, indurated, ulcerated, bleeding, or otherwise suspicious for invasive squamous cell carcinoma. The key differential diagnoses include seborrheic keratosis, squamous cell carcinoma, basal cell carcinoma, and superficial basal cell carcinoma. The treatment of AK is aimed at eliminating the atypical keratinocytes and preventing progression to squamous cell carcinoma. First-line treatment for isolated lesions is cryotherapy with liquid nitrogen, which destroys the lesion by freezing. Field therapy may be preferred for multiple or widespread lesions using topical chemotherapeutic agents such as fluorouracil 5%, imiquimod cream, or photodynamic therapy. Other options include curettage and electrodesiccation or laser therapy in select cases. Sun protection is a critical part of management. Patients should be counseled to use broad-spectrum sunscreen daily, wear protective clothing, and avoid peak UV hours to prevent future lesions.